There's a condition that affects 1 in 5 women of reproductive age, and up to half of women over 50, that isn't talked about enough: uterine fibroids. What are uterine fibroids?
They are very common benign tumors in the uterus.
This is Dr. Sian Chang, Chief of the Division of Obstetrics and Gynecology at UW-Medicine. Her clinical focus is gynecologic surgery, and she knows a lot about uterine fibroids.
They are believed to start from one muscle cell and clone themselves.
Since fibroids originate from uterine muscle cells, they can grow on any component of the uterus, on the exterior, within the walls of the uterus, or in the uterine cavity. Most patients have multiple fibroids, and the size of fibroids can vary as well.
Fibroids are typically under 10 centimeters, probably most commonly under 5 centimeters.
That's about the size of a lime, if you're wondering.
Probably the biggest fibroid I've taken out was 15 pounds, so they can get very big and go seemingly undetected until they get that big.
It's hard to imagine, but it's very common for people to have fibroids and not know it. Asymptomatic fibroids may only be detected during imaging studies done for other reasons.
Sometimes they're detected at the first prenatal visit. We're doing an ultrasound of the baby and it's, oh, by the way, you have fibroids.
In other cases, fibroids are detected in asymptomatic patients during their annual wellness appointment.
They get a pelvic exam and we notice that the uterus is unusually large. Then follow up with imaging to confirm these are fibroids.
So who's at risk for uterine fibroids? Well, basically anyone with a uterus can develop uterine fibroids. And since they often go undetected, no one knows for sure how many people actually have this condition. One thing doctors do know is that there are disparities in who gets fibroids.
We definitely see a predisposition to developing fibroids, and certainly bigger fibroids at a younger age in Black women. For a long time, it was thought to be a genetic predisposition, but there's more and more research pointing to, are there environmental factors that these Black women are exposed to that predisposes them to the development of fibroids?
Some of these environmental factors may include chronic stress from experiencing racism and disproportionate exposure to pollutants and endocrine-disrupting chemicals. Those endocrine disruptors can cause a hormonal imbalance, and hormones play a role in fibroid development, with certain age groups being more likely to get fibroids.
Even though we don't really know why they start in the first place, we do know that they have progesterone and estrogen receptors, and therefore they tend to be an issue in premenopausal women, and they also tend to shrink after menopause.
Although they often go undetected, fibroids can cause uncomfortable or painful symptoms.
I would say bleeding is probably the most common symptom. Certainly they can also cause pain and pressure if they get really large. In terms of bleeding symptoms, most commonly patients talk about their periods changing, periods getting increasingly heavy, lasting longer, using more sanitary products.
Abnormal bleeding from fibroids can also happen separately from periods, which can be confusing.
If a person comes in and says, I had 2 periods this month, one's probably a period, the other one's probably just the fibroid bleeding.
You should seek immediate treatment for fibroids if you are experiencing abnormal or prolonged bleeding. This could be a medical emergency.
Fibroids in the uterine cavity can bleed so much when a period starts that patients present to the emergency room and they're profoundly anemic and need a blood transfusion.
Even if fibroids aren't a medical emergency, they may be bothersome enough to prompt a visit to the doctor. Thankfully, there is a wide range of treatment options available, so treatment can be customized to the individual, depending on the nature of their fibroids and their goals.
Fibroid management is such a personal decision by the patient, and so I think it's really important to talk to the patient about what is their expectation. Are they looking at management that's directed towards, I want a future pregnancy, or are they looking at more definitive treatment, a management option where I can be guaranteed I'm going to have no bleeding?
Treatment options range from non-invasive to surgical procedures. On one end of the spectrum are medications to relieve pain, hormonal options including oral contraception to reduce heavy periods, and tranexamic acid that works to decrease bleeding. Moderately invasive treatments can include uterine fibroid embolization, MRI ultrasound surgery, which uses high-frequency waves to destroy fibroid tissue, and myomectomy, which is the surgical removal of fibroids while preserving the uterus. At the most definitive end of the spectrum is a hysterectomy, a surgery that removes the uterus entirely. This guarantees that fibroids and their symptoms won't return.
When I think about that gamut of options from least invasive to most invasive, another one is expectant management. Wait and watch. Monitoring, watching, see if they develop symptoms is certainly a reasonable option.
So you may be wondering, is there anything you can do to prevent fibroids? Well, since doctors don't know what prompts fibroids to form in the first place, we don't really know how to prevent them. Rest assured that if you have uterine fibroids, it's not your fault. And remember, it is possible to find treatment that works for you. Your doctor should explain all your treatment options, including the potential consequences of each. They should listen to you and work with you to create a plan that meets your needs and goals.
I think it's important to know that if you are suffering from fibroids, that we have so many options for management and for treatment, and that there is hope, and to be willing to let your providers know what bothers you the most so that we can address it.